Could a simple daily routine truly be the answer for back pain? Is it possible it can help you live a more full life and live more functionally with better movement? The answer is yes. We've developed a process we call the daily relief routine. You do it every day. Simple activities you do every day. And every day you get a little better at them. And as you get better at the daily routine, your life gets better. It helps you develop new habits. I did this as a result of a back problem that I had. I suffered for 10 years and I couldn't find a way out. And I started to do the daily routine and my life got better. Every day a little better. I had severe degenerated discs, stenosis, sciatica, herniated disc, and I got better. And I have more energy. I sleep better at night. I don't have any pain. That's the goal. The system works. We've perfected it over 25 years with 26,000 patients. Perfected the daily routine. You do the routine, your life gets better. 500,000 treatments. It's been perfected by a team of medical doctors, chiropractors, physical therapists, nurse practitioners, PhD researchers, and we do research on our process. We've been published in medical journals on this process. We've had 8 different studies. You can access our studies through PubMed.gov. It's the government database for scientific literature published in medical journals. We've been featured on several different TV shows. It's archived with the National Institute of Health. Why? Because it works. We've worked with Hall of Fame football players, Dan Hampton, Steve McMichael, Chicago Bears, Super Bowl champs, Kevin Butler, Otis Wilson, and more. It works for some of the most severe back pain. Herniated discs, bulging discs, degenerated discs, stenosis, spondylolisthesis, sciatica, arthritis. Doesn't matter what the problem is, it works. It works very, very, very well. Now, it works even when it hasn't worked with other treatments for you. If you've been to chiropractors, physical therapists, done the injections, and or had the surgery, it'll work for you. The problem is they weren't treating the cause. If you don't treat the cause, the problem doesn't go away. We have a study with 1,200 patients, and every single one of those patients had gone through therapy and didn't get better. And they got better with us because we treat the cause. This is the billion-dollar study. If these patients had these numbers with the level of improvement that we get, and they had fusion, it would cost $1 billion. So the daily relief routine removes the cause. The cause is in the disc. We did a study where we had analysis using MRI, weight bearing. So you're standing up straight and we have you bend in multiple directions and looked at the discs. And what we found out was there are certain movement patterns will make the herniated discs and the bulging discs worse. So what happens is every time you move in the position that makes it worse, you re-aggravate it or you perpetuate the process. 24 vertebrae between the head and the hips. Vertebrae are the bones. In between each bone there's a disc. The disc is like a jelly donut. Inside the disc there's a jelly. The jelly can move. Movement patterns will force the jelly into a direction that can aggravate the spine. Jelly donut looks like this. Jelly on the inside, annulus on the outside. The jelly will start to push out as a result of posture and movement patterns. And those postures and movement patterns that are specific for you will perpetuate that problem and you'll develop a little tear. And that tear in the annulus gets aggravated with poor motion and poor posture. So there's certain movement habits that you have every day that are aggravating your spine. You eliminate those and your life starts to get better. It's the aggravation of the annulus over time that perpetuates the problem. And the more you move into positions that makes it worse, the more the tearing of the annulus you get and the worse your life gets. How do you solve it? Better posture and better movements. That's what the routine is. It's It's a combination of movements and postures. Very simple. Again, you do them every day, and it lowers your pain sensitivity. Why? Because you're not aggravating the disc anymore. So when you're not aggravating the disc, what happens? Your back pain goes away. It's like hitting your thumb with a hammer every day. Say, boy, that really hurts. Okay? We're going to stop hitting our thumb with the hammer, and the pain is going to slowly start to get better. But also the key is it will prevent the future episodes of back pain. It's very predictable. You keep doing poor motions and the pain's going to keep coming back and perpetually get worse. You stop doing those motions and it starts to get better. You don't have the future episodes of back pain. It goes away, it doesn't come back. Okay, it's not a miracle, but it is a slow, repetitive routine that is very effective. Okay, it's the poor posture and the poor movement habits that gives you future attacks. We're going to eliminate those. As you eliminate those, everything gets better. Okay, this is a strategy. The more you do it, everything gets better. And you can incorporate this habit into your life, and you can really do this for anything in your life. You can make anything better. We're starting with the back. Okay, so there is hope. Okay, helps you take control of your back. There's no mystery in the back. Everybody you talk to, oh, it's the big mystery. We don't know what's wrong with you. We don't know why your back pain keeps coming back. You had surgery, you should have been better. Well, the faulty movement patterns made it worse. That's why it doesn't get better. Take control of your back. This will help you take control of your back and your life. Because when your back is bad, your life is not as good as it could be. We're going to help you live your life again.